Hi everyone, my name is Tannis and I am a survivor of Cushing's disease. I've been in remission for 5 years now. And I just in the last few days on Facebook I have heard people mention that it doesn't seem like anyone ever gets a cure or everyone ever goes into remission. And the only people that are on this site are people that are fighting Cushing's. So what happens to those of them that do get a remission, and is it possible? So I'm here to tell you that yes, it's possible. And that there is hope. And thank you, Ray Collins, for starting this. I think it's so important to get education out there on this disease. When I read about other people's journeys and hear about other people's journeys, I feel so blessed. I had an incidental finding of a tumor and I got treatment right away, and I didn't have to fight with insurance companies because we're from Canada, so we have a public healthcare system, and everything was just right there. And I just can't imagine going through what I went through and have to deal with insurance companies and worry about finances and everything on top of getting better. So for all of you out there that are going through that right now, I admire you so much. You can't even begin to imagine how much I admire you. So my first symptoms of Cushing's disease, thinking back, were 12 years ago when I was pregnant with my third baby. I had two previous pregnancies that were normal, no complications. With my third one, I developed gestational diabetes. I gained a lot of weight. I developed hypertension. I was depressed postpartum. And to top it all off, 2 months postpartum, I gained 45 pounds, which added to the depression. I did not understand what was going on. My gestational diabetes did go away for a couple months, but then it came back with a revenge, and then I was officially a type 2 diabetic. I was eating 1,000 calories a day. I was going to the gym 6 days a week, and I could not lose weight no matter how hard I tried. So my doctor sent me to another physician to help me with weight loss, and I was keeping a food journal and I was keeping an exercise journal, and she smiled politely every time I went in, and I know she's thinking, how can this patient possibly be eating 1,000 calories a day and not losing weight? There's no way she can be eating and doing this much exercise and not losing weight. But she continued to humor me and work with me, and eventually I just gave up. But I'm destined to be diabetic and fat and have bad hair and be cranky, and that's just the way I am, and people need to deal with it, including myself. Then in July of 2007, my dad had a brain aneurysm, and because my grandfather and my uncle also had aneurysms, they figured that they should do a screening MRI on me to make sure that I too did not have an aneurysm. So I went for a screening MRI, and it came back, that was April 2008, it came back saying this patient does not have an aneurysm. However, we did find a 9 millimeter tumor on her pituitary gland, and does she have any endocrine issues? Recommended follow-up MRI. So in August of 2008, I went for a MRI, and it came back the tumor was now 1.1 centimeters. Now whether it had grown or the MRI just got a better image of it, I don't know, but I had this tumor on my pituitary gland, and it was suggested that I be referred to an endocrinologist. I was very fortunate that I got in with an excellent endocrinologist, Dr. Lois Donovan, and I went to see her, and she examined me, and in addition to the diabetes and the high blood pressure and the weight gain, my face was super round, my hair was thinning. I had a buffalo hump. I also had these fat pads over my clavicles, which I'd had a CT scan on to make sure they weren't lymph nodes, and it came back that they were just fat. So, excuse me. She said to me, you have Cushing's disease. She said, I never diagnose my patients without blood work and testing, but I am confident that you have Cushing's disease. And if it comes back negative, the testing, I'm going to send you again, and I will keep sending you until we get a positive result, because I know that you have Cushing's. So part of me is like, yay, I've got Cushing's disease, and yay, I have a tumor, and that's why I'm fat and diabetic and apparently cranky, irritable. I didn't think I was, but my family will tell you that I was. And I was really happy about it for a couple days, and then I thought, started doing a bit of research, and I thought, this is not good. Although now I know what's wrong with me and I'm going to be able to get help, this is not good. As far as I knew, up until that day, the only creatures that got Cushing's disease were horses and dogs, and not people. So I went, I got referred to a neurologist, and I went to Dr. McRae in Calgary, and she said, we're going to get there, we're going to do this, we're going to do the surgery, and you're going to get better. I have a very high success rate, but you need to know that if we don't get all the tumor, surgery A won't be successful, or it will come back. So she's very matter of fact and straightforward. No warm fuzzies there, but I knew where I stood with her, and I had complete confidence in her. And that was November. Her booking clerk, have more confidence in the doctor than the booking clerk. The booking clerk lost my OR booking, so I didn't actually end up having surgery until March 2009. March 4th, 2009, I got a surgical cure for Cushing's disease. I remember the endocrinologist talking to me in the morning saying, you know what, you haven't crashed yet. We don't think the surgery was successful. We're going to have to watch and see what goes on with your blood work, but you probably still have Cushing's disease. And as she's talking to me, I'm feeling worse and worse and worse, and I'm starting to shake, and I'm starting to vomit. I'm cold. I felt like doom had come over me. I thought that was the end, and I was checking out. The nurse came in, the doctor left and checked my AM blood work that she hadn't gone back yet, and my cortisol. Now in Canada we measure it different than the States, and I don't know, I think it has something to do with imperial metric, but prior to my surgery my cortisol was 692, and that morning my cortisol was 40, so I was in a full-blown adrenal crisis. So they gave me hydrocortisol. I realized I wasn't going to die, which was a good thing. My blood pressure dropped down to 60/40, so I was not feeling well. And the endocrinologist came in and she said, congratulations, your cortisol's in your boots. It was a success. And from then I stayed in neuro ICU for 4 more days. I developed diabetes insipidus, which was transient, and it did go away. I looked like somebody had taken a baseball bat to me. My face was big and swollen and green, and my hair is red and frizzy, and my nostrils were packed and pushed up, and I looked like Fiona from Shrek. Not a word of a lie. I really wish I had taken pictures. But they ended up having to break my nose to do the surgery. They had tried to go transfemoidally and they couldn't, so they had to go through my top lip, and then I had a double septum, so they had to break my nose, and I got a nose job in the deal, and it's all good. I spent another 5 days after ICU in the hospital, and then I came home. And when I came home, that's when I began the journey of weaning off of the hydrocortisol. For any of you that are going through this now, trust me, it gets better. I remember thinking on many a day, why did I do this myself? Why didn't I just keep the tumor? Because I felt I was fat, had diabetes, but I felt a whole lot better than I do now. I was achy, I was always cold, I was tired. Life was just rough, and I just thought, this is crazy. But as the year went on, it took a whole year to wean off, and as it went on, I feel pretty good. I went from 270 pounds down to 195 pounds. My hair is better. I have nice hair now. Can't tell it's all pulled back, but my hair looks way better than it did when I had Cushing's disease. My face isn't round. Although I still have diabetes, it's way more controlled. It may or may not ever go away. And life is good. I work full-time. I train dogs part-time. I have 3 of my own children. I have 2 stepchildren. I've got a beautiful grandbaby. I have 4 dogs. I coach basketball, and I just live life to the fullest. And I know that it can come back. Not a day goes by, not one day I'm sure goes by that I don't think that I had Cushing's disease, and how fortunate I am to be in remission, and that there's a good chance that at some point along the way it will come back. If that doctor left one cell in there, the tumor could come back. But there's nothing I can do about that. The only thing I can do is live life for today, live in the here and now, and stay healthy and do everything I can to be in the best position I can be to fight it if it does come back. And anyone who's going through this journey, just keep fighting, because it is so worth it. I'm going to try not to cry. But I have a family, and I have a life, and I've got an amazing husband, and I'm going to enjoy them every minute I can. And if it does come back, I'll cross that bridge when it gets to it. But I'm confident that I'm good to go. And I think about it every day. And December is coming up, and that's my 1-year checkup with my endocrinologist, my yearly checkup. And I know that when I go in there this December, she's going to say, keep doing what you're doing. You're doing great, and you're still in remission. So hang tight, keep up the fight, and know that people on this website are here to support you if you need it. Bye.